Since beginning of this year, the Ebola outbreak in West Africa has killed more than all other known outbreaks combined since 1976. By the end of November 2014, the disease has reportedly killed nearly 6,000 people. Many questions remain today on how the EU has reacted and should tackle this crisis. So we brought questions from stakeholders and politicians directly to Styliades, the Commissioner for Humanitarian Aid and the man in charge of the Ebola issue. The EU has pledged nearly 900 million to help tackle the Ebola crisis, but some MEPs have criticised member states for their reluctance to fully coordinate and scale up the efforts during the summer.
Of course, you are now very busy with one disease, Ebola. You've been in West Africa. Knowing that we would meet you, we asked a lot of people around, being in Africa, being aware of the situation there, if they had questions to ask you, and many of them had questions to ask you. First of all, a former colleague of you, Linda McEvan, you know her, she's an MEP at the European Parliament, and I would like to present you this question, so let's have a quick look at the question.
Yes.
Here we are.
Commissioner, many people have said that one of the reasons that the outbreak took hold in West Africa, in these countries, was because their health systems were devastated by civil war and didn't really exist. Did you find that to be the case when you visited these countries? And if so, what are the long-term lessons for the European Union in terms of making sure our aid goes directly to public health and to ensure that this never happens again?
I totally agree with Linda McEvan. Of course, the discussion about constantly improving the efficiency of the humanitarian assistance and development assistance remains a real challenge for all of us as humanitarian international community. This is why our commitment as European Union is long-term, not short-term.
So some people would say you had the long-term quite a long time before to organise this so that this would not happen. This is a bit the question of Linda McEvan. What did we learn out of it? We maybe did a mistake.
We insist that we need, at the same time, urgent measures for specific needs and gaps now on the ground, but at the same time to rebuild healthcare systems.
Then, as you said, on the ground, I have another question coming from MSF, from Médecins Sans Frontières, an organisation which complained quite a lot about what was done at EU level, but also at UN level. Let's have a quick look at this gentleman
my name
here.
is Henry Gray. I'm the Médecins Sans Frontières Ebola Operations Coordinator. The EU has committed to support general healthcare services in the affected countries. This is a key area that needs support and does not require specific Ebola expertise. What concretely will the EU do in the coming weeks to improve access to healthcare services for non-Ebola related cases?
MSF has a decisive role in the battle against Ebola. We are fighting on two specific fronts. First, to send more medical personnel and equipment on the ground to the three affected countries to address the immediate needs. And second, as I already mentioned, we need a specific plan for the reconstruction of the healthcare systems.
MSF has something very specific. They don't want the money from institutions. They just want a clear commitment to something. So you are ready today to give this commitment?
Of course.
Yeah. Concretely, what will you do for these non-Ebola cases? Do you send people? Do you improve the machinery?
Yes. The medical personnel of each European countries is not only focused on Ebola disease, but at the same time, these persons have specialized in many other aspects of the medical process. We need not only doctors, but at the same time nurses and hygienists. And this is a new infrastructure to rebuild the healthcare systems for all diseases, not only on Ebola treatment.
I would like to show you another question from people working there too.
Les patients suivis pour Ebola sont traités dans des services spécialisés. Mais qu'en est-il de la personne qui présente simplement des symptômes après un séjour en Afrique et qui va s'adresser à l'établissement de santé de sa ville? Quel est le niveau de la formation de l'ensemble des professionnels de santé des pays membres par rapport à cette prise en charge des patients qui peuvent s'adresser n'importe où? Et est-ce que tous les services d'urgence disposent d'un matériel adapté?
Yes.
Of course, you are responsible for the other part, but do you have also an answer for Europe?
Regarding preparedness, the World Health Organization, WHO, has issued a strict code of control measures. And it's must this code be followed, definitely. One of the main keys to prevention is to inform the public with clear and simple information, of course. And at the same time, to follow the medical protocols in any process and procedure, in any step of the process and procedure.
Do you understand the fears of the people when they... I mean, we're in Brussels here. Brussels, the city of Brussels, had a month ago not even the possibility to make tests.
I'm against in any hysteria approach. At the same time, entry screening implemented by several member states is necessary. And of course, we already have protocols for travelers returning from the affected countries, which prepared by the European Centre for Disease Prevention and Control. I think we are ready to face anything in this field. I'm sure for this.